Yes, good evening. How are you, everyone out there? This is Dr. Soliman and another session of Your Health Today in My Media Prime. It is 5 p.m. on a Saturday. I would like to start this session today with a good announcement to everybody who is in need for surgery, whether this surgery is general surgery or a tumor surgery or a thyroid surgery or even gynecological surgery. We have a team of specialists arriving to Cameroon, hopefully this coming up Friday, the 9th of December, and they will be staying for about 12 days. The surgeries are free, and they will take place in Marwa. You have to let me know so I can schedule your name on the list. Once again, we have a specialized team for all kinds of surgeries, including gynecological, cancer surgeries, general surgeries, any kind of surgeries. If you are in need of help and you do not have enough money to do any of those surgeries, contact me at Dr. Soliman, Clinic Cell Lab. You can find me in Facebook. The number is played right here on the screen, so I take this chance and advertise free surgical procedures will take place in Marwa. The team will be arriving next week. So let me know if you're in need of any of those surgery. We do the evaluation and we send you there. Thank you very much. We're gonna start now our session today with a case that has came to my attention last week. Is the lady with the child. If Mr. Johnson can play the video, we watch the video together for a few minutes and then we discuss the case. Okay, till the video is ready. Okay, here it is.
Is it okay to share this on media and on TV to educate other parents about the condition?
It's no problem, doctor.
Okay. Now, in 1 or 2 minutes, can you tell me what you just have told me now about this baby?
Okay, doctor. I had this baby at 33 weeks with induction and forced labor. So at that time, the baby came out. The doctor, the gynecologist, the pediatrician, all of them, they were there. So the gynecologist asked the pediatrician if it is okay for the baby to go the next day. So it was okay by the pediatrician that the baby is fine since she was having 2.2 kilos.
Yes.
So the next day after birth, I was discharged. So I went home with the baby. After then, the baby started crying seriously. The baby was crying. I couldn't help myself. So I had to go back to the hospital and complain. So for where I get there, they told me they don't have neonatal, that the baby is sick in neonatal.
Yes.
So I was referred to Nsah.
No, don't say names.
Okay, sorry.
All right, wonderful. There is also another video on the same lady. Maybe we can also play it as well, and then we'll talk about both videos at once. It's all one condition. Please, Mr. Johnson.
I was referred to another hospital where they had a neonatal there. So when I went there, they discovered that the baby had yellow skin, which is jaundice.
Okay, let me stop you here. We've been talking for about half an hour now, just taking history from you. And you showed me a lot of investigations that have been done that include 2 MRIs.
Yes.
And that includes a lot of EEG that's done twice.
Yes.
And it just, MRI didn't show anything.
Yes, doctor.
And it's after taking the history that we realize now I can put my finger on what the problem is.
Yes.
That baby at birth, since she was premature, I'm going to explain the scenario now. What happened?
Okay.
Since she was premature, the liver was also premature. It is the liver function to turn one chemical from lipid soluble to water soluble. Okay, that is bilirubin. So since the liver was not functioning yet and it was premature, high liver at that time of delivery could not transfer the bilirubin from fat into water soluble, which means that bilirubin accumulated in her body.
All right, how is everybody out there? Let me again announce we have a surgical team arriving from overseas, specialists, highly specialist surgeons for all different kind of surgeries, tumor, gynecological surgeries, thyroid surgeries, general surgeries, any kind of surgeries will be arriving next week on the 9th. The surgeries will be taking place in Marwa. If you think you are financially in need of help, this is a charity program, so these surgeries will be done for absolutely free, no charges. Let me know, contact me on the number that you see on the screen. I will do the initial evaluation and then we'll send you, refer you to those specialists. We have about 7 specialists, only surgery, all different kind of surgeries that will be taking place in Marwa starting next week. So let me now discuss this case. Let me now discuss this case together and see what happened to this baby. And at the same time, we can share some advices for those who in need for advices, because this is a very crucial case. This is a very important case, and the victim is a baby. The victim as a baby, as you have seen on the video. Now, what happened here? You know, the lady came in. She's complaining about the child cannot keep steady. As you can see, the child cannot walk. There is no stability, you see? There's no stability. The baby would try, the baby cannot walk. The baby muscles are hypotonia, meaning it cannot, you know, the muscles are so weak. The baby cannot keep steady. And if you notice the neck is like going retrograde, going to the back a little bit. So this is now, this is a very, if you do not know this condition, you will definitely get a lot of wrong investigation ordered, wrong treatment given. The key word for this small baby here, that the baby was yellow. The moment when taking the history, I like to take the history very carefully. Pay attention to every single small details, because the lady, the mother, threw about 20 different investigations that were done, very expensive investigation, among which 2 MRIs, 2 EEGs, you know, lab tests, serology here, oh my goodness, a lot of tests, and the results is nothing. Go to neurologist, go to hepatologist, go to this, go to that, at the end, nothing. Let me explain to you the case, what happened, what has taken place. The mother, she was delivered premature. When we have a premature baby, we have a premature everything inside that baby, including a premature liver. The most important function of the liver is production of albumin, and converting a substance that is very toxic, yellow substance that is fat soluble. That means if you pour it in water, it will float. It's like oil. It will convert that substance that is yellow, that is oily, convert it into water soluble, and then excrete it in the urine. The urine cannot excrete oil. You know, if you drink 2 liters of oil, don't expect that you will urinate oil. You will urinate the next metabolized, solubilized oil into a form that is now excretable in the urine. Okay, that is the function of the liver. It takes that oil and it makes it absorbable. It's either by emulsifying or by converting, like substance. We're talking about a specific substance here. That yellow oil is called bilirubin. The liver takes that substance and convert it into soluble bilirubin. It's no longer yellow. It goes in the urine and it makes the urine a little bit dark, a little bit yellowish. That is the bilirubin in the urine, that the liver has taken it and converted it from a toxic material into intoxic and excreted into the urine. I have an image. If Mr. Johnson can play the image, then we will be able to understand much better. Please, the image that shows the liver and the brain. So if we look at this image together, we'll understand what happened to that baby. We'll understand very well what happened to that baby. The liver supposed to be mature. Mature meaning a term of delivery, meaning the baby is born to term. When the baby is not born to term, that liver is immature, and the capacity of that liver to convert bilirubin to soluble bilirubin is very much limited. As a result, as you can see here, the liver will not be able to convert bilirubin, and the bilirubin will go much higher in the blood. The bilirubin will go much higher in the blood, causing this yellow skin, yellow sclera. And at some point, when it becomes too much, more than 30 milligram in 100 mils of blood, then it crosses the brain. The brain normally is protected by something called blood-brain barrier. It's a protection for the brain for not to get easily to the brain. Brain is nothing but lipid. Lipid meaning fat. This is what the brain is composed of, nothing but lipids. And this substance, we said it's oil. So oil get dissolved in lipids, which is another word for fat. The brain is nothing but fat. So this substance, because it is fat, because it is oil, it crosses the blood-brain barrier, which is the normal protective shield around the brain that God provides us. It now crosses over to the brain, and it stained the brain yellow. It stained the brain yellow. It didn't cause anything. So there is no mass. So if I take a careful history, I do not need to order an MRI. You know why? Because the stain and dye does not show in an MRI. What is an MRI? MRI is just like CT scan. It's a big tube that you go inside, and it takes a slice of your body, you know, and then I'll be able to see. MRI is the most expensive, most unique, only thing that I can evaluate soft tissue, like flesh, like blood vessels, like different brain tissue, kidney tissue, liver tissue, soft tissue. When we talk about CT scan, we're talking about something that is hard, like bones. CT scan is nothing but an advanced X-ray. That's what it is. I see blood vessels in shadows, so I'll be able to translate what I see. But MRI, that is the highest and the best thing for soft tissue. So when I order an MRI for a baby like that, what do I expect to see? The condition is very obvious. The minute the woman said the baby was yellow, boom, that is the trick, that is the key, that is the secret. I already know what the baby got. That yellow substance, since the baby was premature, the liver didn't have enough time to convert bilirubin into soluble bilirubin. Okay? We don't want to do and mention the medical terminology because it might get you confused. The words are sometimes difficult to pronounce. But nevertheless, we're dealing with something very easy here. The liver is premature, cannot convert something that is oily into something that is like water. Failure to do that, this oily substance make its way to the brain because the concentration is very high, and now the brain is stained yellow. Is it normal for the brain to be stained yellow? Absolutely not. The same way your skin was stained yellow, the brain also got stained yellow. Is that normal? It is not normal. Can I see a stain with an MRI? I cannot see a stain with an MRI. Can I see evidence of the stain with the EEG? I don't think so. So what happens when that yellow substance goes to the brain? The brain cells die because this oily material suffocate the cells, it chokes the cells, it kills the cells. So those cells who didn't die do commit suicide by a process called apoptosis. So the cells kill themselves because the environment is not good for them anymore. So what happened here? We have a permanent brain injury. We have a permanent brain injury. The cells of the brain have died off because of this yellow substance that we failed to eliminate from the baby's body when time was right. So now what we have here is a chronic encephalopathy because of bilirubin. Can this process, can we, with the baby that we have seen, can we reverse this process? Absolutely not. Once the brain cells die, there is no coming back. Did we have a chance early on in the course of the disease to reverse the process? Absolutely yes. Are there signs and symptoms to tell me that this baby have this yellow substance and we need to do something about it? Yes, the baby was yellow. Now, they send the baby home. They should not have sent the baby home. The baby was premature. When we have a premature baby, what happened? The lung is immature. We have a substance called surfactant that is responsible to make the lung balloon out when you take a breath in and collapse back when you take a breath out, when you exhale. That is the function of this substance, surfactant. It balloon in, balloon out, balloon in, balloon out. If this substance is not there, the baby will have difficulty in breathing. Fortunately, this baby didn't have that difficulty. Surfactant was there. They managed where he was born to make him breathe well. But the problem is, the baby was yellow. When the baby is yellow, is God gifted sign to you to see that this baby needs intervention. That's the sign there. The baby was yellow equals to baby needs intervention. They did the intervention. You know what they did? They put the baby under a special light, okay, and for a couple of days, and that's it. The baby goes home. Is that enough? In some cases, yes. If the bilirubin is less than 30 milligram in 100 mL per blood. Obviously, this baby was more than 100 milligram in each 100 ml of blood. So when I did that, the phototherapy, we call it, put the baby under a lamp, I reduce this yellow substance by 25%. This is it. That is the maximum this lamp can do. The maximum, assuming it's a good lamp, good environment, good positioning, everything is done correct, that is 25% reduction. What about the rest? I cannot do. Is any other way to do it? Yes. What is it? Exchange transfusion. This baby is not missing blood. He has his amount of blood. So I have to take some blood from him and give him another blood. That's what we call exchange. I take, I give. Exchange transfusion. There are signs and symptoms and stages the baby will go through. Initially, the baby will cry all the time. The baby is always asleep. You can wake him up, but he goes immediately back to sleep. He cannot suckle enough. That is early stage. It's very difficult to know the early stage because babies tend to sleep too much anyway. But the second stage, which is the intermediate stage, you should recognize. Why I'm saying that? So we don't have repeated cases like that. So you be aggressive if you take the baby to a center and you know the baby is still manifesting the same way I'm telling you, you know, you should take the baby to another place that has a specialist that deal with newborn. So what is the intermediate stage? The intermediate stage when this yellow substance is high, what is that? The baby now is like, you know, you look at the neck, you see the neck moving forward, I mean backward like this, and the baby is going like this, you know, like the neck is always going to the back. Crying all the time. The hypotonic muscles, the muscles are weak, the baby cannot stand on their own. That is the intermediate stage. And this is when you should act and take the baby to a specialist and ask the doctor to do exchange transfusion and measure bilirubin and tell me if bilirubin more than 30 milligram in 100 ml of blood. That is what you should do. Why I'm saying that? Because it is sad to see a baby, you know, suffering like this for something that could be prevented, for something that could be easily prevented. Yes, could be easily prevented. So, if you're watching me out there, please share this video to everybody you know. Maybe we spread the knowledge and maybe we can save the next baby from something like this happening to them. I will take 1 minute break, and before I take the 1 minute break, I'd like to announce again, we have a surgical team coming to Cameroon next week, and they will be doing all kind of surgeries, from thyroid, from tumors, from gynecological, if you have myomas, if you have fibroids, if you have any problem that requires surgery, you contact me, we'll put you in touch with them, we'll refer you to them, and they do the surgeries absolutely free. Okay, they do the surgeries absolutely. This is a highly specialized team that will be arriving to Cameroon next Friday. So contact me if you need help, and the surgeries will be taking place in Marwa. 1 minute break, and we'll come right back.
When it comes to toxic elimination from the human body, the liver and kidney plays a vital role. Your health is your wealth and therefore needs to be kept in constant check. Dr. Soliman Clinic and Labs offers you the opportunity to find out about your liver and kidney today. With us, you will have a free liver scan and hepatitis B test by Elisa just at 5,000 francs CFA. Find out the state of your kidney. With us, we offer free kidney scan, and if your creatinine is above 1.5, we have the solution. In addition to that, we also offer free medical consultation and free body scan. It is in Boya, we are located at mile 18 Bomaka. In Vola, you can find us at Bonaberry, precisely at Entrepilot. You can also reach us through the telephone number 694-940172. Your health is at the right place with Dr. Soliman.
Welcome back. This is Dr. Soliman again, and now we're going to discuss another new case. A young lady. If Mr. Johnson can please play the next video for that lady with the white mask.
And we have mild abdominal ascites. And then when we send her to the lab, we find out in the full blood count that we have leukocytosis, which is the cells responsible, the white blood.
You know, the possibilities here in this case, somebody, young lady like this with a swollen feet, I don't think it's the heart. Because the problem actually when we have a swollen feet, it could be the heart, it could be the liver, it could be the kidneys. One of those three, something is wrong. And we need to evaluate carefully to put our fingers on the cause. Where is the problem and what is happening? And then we can easily, treat. So now, we look at the heart, and it is not cardiogenic. Cardiogenic meaning the heart is the cause. It is not the heart. So we remain with liver, and we remain with kidney. What is the association here? We have discussed this before in cases of hepatitis. The main function of the liver is to produce a heavy protein, a bigger molecule protein called albumin. So the whole thing is about the albumin. So the albumin could be underproduced, meaning producing less from the liver, or over-secreted or excreted from the kidneys, because the kidney is just like a shifter. Shifter has holes. Those holes can only allow smaller molecules to pass, but bigger molecules should not be able to pass. But when I have a problem in the kidney and the kidney becomes infected and inflamed, inflamed things become more leaky. When things get inflamed, they become more leaky. So now the kidney get inflamed for one infection or another, and it became more leaky, and now the albumin that is produced by the liver making its way to the urine. So in simple English, we're saying we are losing albumin. And guess what? When we measure albumin for this lady was 2.6. It's supposed to be 3.8. So we're missing some albumin, and that is the reason there is a swelling. there is also a small amount of fluids in the pelvis, in the abdomen, around the kidneys, a small amount of fluids there. Why? Because albumin is the substance that makes the water in the blood stay inside the vessel, cannot leave. So as long as I have enough albumin, which is the 3.8 grams in each liter, then I'm okay. If I don't have this amount, then the substance that is responsible for holding this water inside the blood so it doesn't leave the blood is no longer there. As a result, the fluids, the clear fluid, the water, the plasma will easily diffuse out of the vessels to the nearby cavities. So if I have the abdomen as a big cavity, what happened? Then all this fluid from the blood leave the blood, goes to the abdomen, and we have what is called ascites. Ascites mean we have fluids inside the abdomen. By the same token, the legs as well, though the fluid will leave the blood vessels and go to the nearby tissues, causing what is called edema or swelling. And that is what we have. So the main cause now is what? Is reduced albumin. So the cause would be, in this case then, is either we have a defective production or a defective excretion. There is some way we are leaking albumin out of this lady. So by the scenario we have in our hand, it looks like the kidney is the problem. So in order for us to stop this leakage, we must fix the kidney first, and then if there is albumin needed to be given, we will give some albumin, or if the liver is good, we'll just wait for the liver to make up the deficiency in albumin for me. And that will solve the case for us. That is the end of the case. That might take a bit of time. We have to treat the infection, reduce the inflammation, fix the kidney so there is no more leakage, and if we're in a rush, we can add some albumin, and in this case, no more fluids will ooze out, no more ascites, no more swelling of the leg. That's a time process, but if it's severe enough, will require faster intervention to do all at the same time. So this is an example of a bad kidney leaking albumin causing swelling legs. By the same token, we have discussed before, if we have a bad liver because of hepatitis, we will get to the same conclusion. But in this case, not because we have bad production, we have bad excretion, but we have bad production. So the liver is the organ responsible for producing albumin. So if we lose the liver function, we'll definitely end up with ascites, and it's very difficult to replace the albumin. It is very expensive, very costly. So what is the advice here? Why would you have to go through all this complication if you can avoid hepatitis or anything that leads to hepatitis? Remember, hepatitis is not only by hepatitis B. It's not only by viral hepatitis. Hepatitis also can be because of alcohol. Yes, alcohol can cause hepatitis as well. So for those who really take a lot of amounts of alcohol, even a small amount can lead to moderate amount, can lead to bigger amounts. Stop before it's too late. Stop alcohol before it's too late, because alcohol can cause hepatitis as well. Viral hepatitis, hepatitis B, get it checked as soon as possible. And when you are hepatitis B S antigen positive, I would rather you take the treatment. Do not tell me there is an inactive virus that is not going to harm me now. We explained this scenario before, and we said the virus only know one thing in life, which is replicate. Go to one cell, which is the building unit of the liver cell, go inside the cell, take over the genetic control, multiply by thousands, burst the cell, more viruses infect more cells, and the process continues. The only thing that is beneficial, that works in your benefit now, is the regeneration capacity of the liver. The liver as well have very high regenerative capacity. Regenerative means it can make new cells as the old cells die off. But this is when you're young, when you have good immune system. If the regeneration capacity wins, you are okay. Your liver will remain okay. But if the virus wins and all the cells go boom, explode, 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 and become a scar, you're going to now go to a stage called cirrhotic liver. And cirrhotic liver is like scars, like a bunch of scars there. So you cannot really make anything because the cells are empty. It has been eaten up by the virus. So you got no liver left. And this is when things go bad. Go bad meaning, you know, you have the ascites, you have bleeding from the esophagus, you have bleeding from the rectum, you're not making clotting factors, you bleed all the times, plus the portal hypertension is so high, when it meets the systemic circulation, you know, at the points, at the weak points, like the rectum, like the umbilicus, like the esophagus, all of those start to blow up. You need ligation every now and then. I mean, and when this liver fails, believe me, it doesn't fail by itself. It sometimes takes the lungs with it. We call hepatopulmonary failure. Sometimes we take the kidney with it. We call it hepatic renal failure. Sometimes it takes both. So hepatic pulmonary renal failure. So multi-organ failure. When the liver fails, everything else fails. And that will be the end of your life. So it's much easier to do simple test. Do I have hepatitis? Take the treatment. What is the function of the treatment? Well, the function of the treatment, according to all the studies that has been made, is delay going into cirrhosis by at least 20 years. When we have liver hepatitis today, it is silent. You feel nothing. Everything is good. And for you, as long as it doesn't pain, who cares? Why would I spend? Why would I get treated? For what? I'm doing fine now. But 15 to 20 years down the line, when you have cirrhosis, and there is no reverse, then you will say, I wish I have done it. And I don't want you to wait till you say, I wish I have done it. We take another 1-minute break, and we come back and we discuss skin diseases.
Are you facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bolifamba, and in Douala, we are located at Entrée Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Yes, back again. How are you? Again, I'd like to announce the surgical team, specialized surgical team, arriving to Cameroon next week. We will be doing all kinds of surgeries for free, no charge, all charity cases. If you have any problem that requires surgery, whether thyroid, general surgery, gynecological surgery, cancer surgery, any surgery that you want to do, we have about 9 specialists, different kind of branches of surgery will be arriving to Cameroon next week. Surgeries will be taking place in Marwa. If you need a surgery, you let me know. And if you know somebody who needs a surgery, you let me know. Surgeries are done free of charge by a highly specialized team. All right, back again. We're going to discuss now this time something that concern the skin. We have a picture that I like to share with you, and then we discuss about the skin. We play that picture, please. Yes. Looking at this picture here, we see, if you look carefully, it's actually a white skin here. Okay, it's actually a white skin. If you look deeper into that picture, you will see that, you know, it is kind of purple. It's kind of purple, right? Yes, it's kind of purple. Why is it purple? Because this lesion is rich for capillaries and blood supply. There's a lot of blood there. And if you pay close attention, you will find that lesion is raised above the skin a couple of millimeters. So it is not at the same level of the skin, meaning if you touch it, is like it bumps up a little bit. You have to bump up a little bit. So that is what this lesion is all about. And if you look closer also to the lesion, you find that it is not even borders. It's not even borders, meaning one side is higher than the other. If you look at the circumference, if you look at the circumference of the lesion, you don't find it even. So now, let me tell you what that is. This is what we call, we see this, you know, at least a couple of times in the clinic, 3 times in a week, okay? And this is a lesion that is associated with HIV patients. This lesion called Kaposi sarcoma. It's a cancer of the skin, exactly like you heard, cancer of the skin. And it usually appears like this when the CD4 count goes low. What is CD4? CD4 is a T lymphocyte. What is a T lymphocyte? It's your line of defense against viruses. This cells secrete something called interferon, which is the weapon against different viruses and parasites. And even tumor cells, TCD4 is very important for us to fight. And that is what HIV attacks. It attacks your line of defense against viruses. So basically, you know, it makes its way by killing the first line of defense. I mean, the most effective line of defense, which is CD4, because we also have CD8, but, you know, CD8 is not affected as much as CD4. CD4 is #1 victim for HIV. So when the CD4 goes low, that means what? That means the viral load has gone up. When the viral load goes up or the CD4 count goes low, basically both terms mean the same thing. Your immune system is a little bit out of whack, is low. And this is when this Kaposi sarcoma can show. We can have patients with HIV all their life and we never see the lesion. We can have a patient with HIV a couple of years and we see the lesion. It all depends on the immune system of that particular patient and how high or low the CD4 count is. Can this lesion be treated? Yes, absolutely it can be treated, and the treatment is quite easy. The most essential treatment is to work on raising the CD4. The second thing, we can inject the lesion slowly with some medication and it will make the lesion disappear. The fourth, we can have some ointment, special ointment that we apply to the lesion and the lesion will go. The lesion can be in a very embarrassing places like the face, the hands, where it can be seen, the lower legs, which is very nasty, but it could go away. So this is a condition. What I want to teach you here is something very important. We have discussed, I don't know whether in this TV station or another DC station, we have discussed how you differentiate between a skin cancer lesion and a lesion that is benign. Benign means is not cancerous. If you look at the lesion, and I have a slide that says even borders. If you can look for the word even borders among those slides, the slide is there. If I look at this lesion and I find even borders, meaning no ups, no downs, is all even, that's a benign skin lesion. That's a benign skin lesion. But on the other hand, if I look at a lesion and I see it like just the one I played on the screen, now you see the borders are uneven, this is something that is cancerous, like this Kaposi sarcoma. That is because of HIV infection. Yes, we can treat the Kaposi sarcoma. And the earliest you recognize the Kaposi sarcoma, okay, is purple and is raised above the skin and uneven borders. Those are the 3 things that you should look for. If you have this lesion, you let us know. We will take care of it. But the most important thing is you cannot be taking the treatment for this lesion and you're not taking the ART, the treatment for HIV. You cannot do that because once you raise the CD4, it's very easy for this lesion to go away. So you must raise the CD4. Now, how can we decrease the risk for having HIV? HIV is transmitted by mainly sex. Now today we have 2 groups of sex, 2 different sex groups, or let's say sex preference. We have the homosexuals, those who prefer, men who prefer to have sex with men. And we have the heterosexuals, men who prefer to have sex with women. Looking at the two groups here, the homosexuals and the heterosexuals, which one you think will have more HIV? Which one would you think will have more risk to have HIV? The heterosexuals or the homosexuals? Well, data have showed us, and all medical evidence has showed us, those homosexuals are at very much higher risk to catch HIV than the heterosexuals. Why? Because homosexuals prefer anal sex, rectal sex. And if we look at the anatomy and the physiology of the rectum, we find it very rich of capillaries and very fine blood supply. That with the act of intercourse, they get ruptured. And you have now direct blood contamination, especially if you have a laceration on your penis. So now we have blood-to-blood contact, and that is HIV, if the patient is infected, and most of them are, because of that fact. Now, with heterosexual, vagina is not the anus. So it is totally different. Anatomy, different physiology. When God made us, He didn't make us to have sexual intercourse in the anus. Otherwise, why would He make the vagina? So what is the vaginal function here? Is for what? Is to defecate from. We have one thing for defecation, where the stools come out, and we have thing to enjoy sexual intercourse, the vagina. So those with before, and I said it once before, those who are homosexually oriented, men prefer to have sex with men. Those years ago, in the DSM 3 and 4, they were diagnosed as mental disease. Now that they have so much influence with different lobbies, your body has produced to protect you against the virus or pieces of the virus. That is what we call antibody. We cannot, till today, test against the virus or pieces of the virus directly. So we test against the virus indirectly by testing for the presence of antibody that your body has formed against pieces of that virus. That's what we do today. That process to make antibody against the virus and then test positive, it requires 3 to 4 months. It requires 3 to 4 months. So if, God forbid, you catch the virus today, you can only test positive 3 to 4 months later. So what is the advice? Be careful who you have sex with. Get yourself checked routinely. Believe me, I have seen in my practice a wife and a husband. The wife has it and she wouldn't tell the husband that she has it. A husband have it and he wouldn't tell the wife that he has it. Especially the woman. Why? Why don't you say, I'm afraid he will leave me. But is this enough reason to kill somebody? I mean, not kill, but at least, what if he finds out? He gets checked out and he finds that he has HIV. Then what are you going to do? Then what are you going to do? It is sad. It is sad. So the advice is, be careful out there, okay? If you decide to have sex, get your partner checked. Get yourself checked. Use condoms, even though, and this may be the first time you hear that, condoms offer you 84% protection. 84%. You remain with 16% unprotected. You're not protected 16% of the times. You're protected 84% of the time. 16% of the time you're not protected. Condom cannot offer you that protection 100%. There is no 100% condoms. Let's move to another lesion. Now, before I move to another lesion, I just play any of those lesions with the face, the ulcerative lesion there on the face. You know, the most important factor for this one that I just showed you, the Kaposi sarcoma with HIV-related lesion, skin lesion, there is another lesion. You know, most of the other lesions that show in the face is actually because of sun exposure. You know, not this one. This one is impetigo. No. Most of the other lesions that shows in the face is because of sun exposure. So if you are a farmer, if you sell in the market, if you have to be in the sun a long time, be careful to protect your face. Put a big hat over your head, put an umbrella, protect your face, protect your skin from exposure to sun, because the sun is the number one cause for skin cancer of the face or the sun exposed areas. Okay, this is advice, very easy. Like for example, this one here, that's a shiny waxy lesion on the nose, and that is basal cell carcinoma, I believe. You know, so this is, don't worry about the names. Those are cancer. And if you look at the lesion is uneven border. The borders are not equal. It's not round like, no. It's uneven. One area is up, another area is down, then it goes up again, then down again. So uneven borders, that's the distinction and the hallmark of a skin cancer. So that's a skin cancer. You know, a benign lesion will not be looking like this. So all kind of lesions on the face, if you see one, that is because sun exposure. The advice is avoid the sun. There are some products that call sunscreen. They have sunscreen factor. Look for the things that say, and also have the hours. You know, this is cellulitis. This is also another condition, but it's not cancer. This is another condition, but it's not cancer. Well, let me see. I'll send you that. Let me see. So let's now, you know, something like this. Also something like this. Let me see here. Let me see. I don't think I brought it with me. Anyhow, so what I'm trying to say is the following: avoid the sun. Avoid the sun at all times. And if you have to go to the sun, protect your face, protect the area that is exposed to the sun by a big hat or by an umbrella, or by applying a cream that says sun factor. Sun factor protection. It says the hours. If it says 8 hours, you know that you have to repeat to apply the cream again after 3 hours or 4 hours, because they're not always saying the full truth. If they say 8 hours, you assume it's about 6 hours. If they say 5 hours on the sunscreen, then you assume it's about 3 hours or so. So protect your skin from sun exposure. You avoid a lot of skin cancer. But in Africa, we are blessed because, you know, the black skin actually has rich melanocytes. Melanocytes is the cell that produces that black skin. So the more melanocytes you have, okay, that has more active melanocytes, more active meaning they produce in melanin, which is the dark dye that causes dark skin. This melanin is, if the cell is active, you become more dark. If the cell is less active, you become less dark, and so on. So when the skin is rich with melanocytes that are active, producing dark melanin, you're very much protected, less likely to get the skin cancer, but you still can have it though. So the best thing is to avoid sun exposure because we have a lot of sun. Now, what else should I advise you with? I get patients that have hyperpigmentation in this area here. What is this? This area that is coming out, those are the cheeks, they're right there, always come very hyperpigmented, very dark. Why? Because this is the area that is most likely exposed to the sun more. So it becomes hyperpigmented. So before the lady leaves the house, she bought her, you know, oil. She bought her oil, she bought her body cream, she bought her body lotion, and especially in the face, she bought a lot of lotion, and then she goes out. And where she buys her lotion or the face cream that she bought in her face from those side road streets, and that doesn't even have a label on it. And after reading few patients the creams that they brought, we find all of them have ascorbic acid. Ascorbic acid is vitamin C. Never put vitamin C in your skin and go out in the sun. You know, when vitamin C unite or combine or react with other chemicals in the cream, they call carboxyl or you know, ascorbyl complex. They call it ascorbyl complex. This ascorbyl complex, when it reacts with the sun, when it sees the sun, it causes activation of the melanocytes to produce more melanin. So this is ascorbyl complex. Ascorbic coming from ascorbic acid. Ascorbic acid is the vitamin C that this cream has in it, and you don't even know because most of them don't even have a label to tell you what's inside. So any cream that you put in your face and you go out in the sun and this area becomes dark, you know you have a problem that this cream has ascorbic acid or vitamin C. So what is the solution? Do not put nothing in your face when you go out. When you go out to the sun, do not put cream in your face. The only thing you have to do is something that protects you from the sun. There are creams to protect you from the sun. And you will say on the side, S factor or the sun exposure factor. You look for something that if it says 4 hours, then you renew the cream, you reapply the cream every 2 hours. That is the advice for those who are decide to put cream and go out in the sun. Okay? Let's take one last minute break and then we'll talk about a couple of minutes for something new.
Are you facing challenges in your health? Then Dr. Soliman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Soliman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Soliman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at mile 18 Bolifamba, and in Douala, we are located at Entrée Pilote. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Soliman.
Welcome back. In the next 5 minutes or so, we will be talking about this slide here. We're talking about now superficial skin infection. When we say superficial, meaning, you know, the skin has layers. One is the epidermis, which is the outermost, and then followed by the dermis and so on and so forth. Let's play this image and then we'll talk about the skin infections very quick. Now, yes, this is impetigo. This is impetigo. Impetigo meaning the only layer that is affected is the epidermis. There's nothing scary here. You just apply some topical cream and it will be gone. So what is the causative? The causative agent is always something called Staph aureus and Streptococcus group A. Now, in this case, just maybe a little bit of a Staph aureus is topical skin, topical ointment we apply to the skin and it's gone. So this is impetigo. Let's move to the next slide, please. Okay, let me see. I cannot see from here. Let me see. I cannot see very clearly from here. Anyway, okay, I see. Okay, this is actually skin tinea. Skin tinea is, you know, this is very common, by the way, very common. This is very common. This is what it looks like. It looks like, you know, you see uneven borders, different color from the skin. Sometimes it's darker, sometimes it's lighter, and the hallmark is when it starts like very small spots, and it itches. It itches. This is, you find it mostly in folds, skin folds, like between the legs, under the armpit, you know, and it spread fast. It spread fast. This is tinea. A lot of people have it here because maybe the weather, maybe, you know, too much sweat and all that stuff, and it spread very fast. And it easily move from one place of the body to a different place of the body because you move it yourself with your direct inoculation. When you scratch it and then you scratch another part of your body, it moves right there. This is what we call tinea. The advice here, if you're taking something, I don't like to mention drugs names, but I will have to mention this drug name to warn you again. It's something called grazioflovin. Do not take. If somebody tell you to take grazioflovin for tinea, do not take, because that causes a lot of bad side effects. There is a very nice new medication. It's not really new, but it's very effective, very much, almost no side effects, because you know, there are medications to treat those tinea and those stuffs that actually causes impotence, okay? So you have to be careful what you're taking, okay, and how long you take it for. Tinea is very much treated with ointment, as long as no hair is involved and no nail is involved. No hair, no nail, just a small topical cream and it's gone. You don't have to exhaust yourself with griseoflavin and all the stuff. That's a killer. You don't do that. No griseoflavin for anything. Do not do it. Do not take it, even if it's given to you for free. Now, what I want to talk to you about, is regarding those tinea. That's the point, because I see that, patient comes, oh, I have tinea and I'm taking griseoflavin for the last God knows how long. What? Why? If the tinea is only involving the skin, no hair is involved, because when it involves the hair, I'm talking about you see it in the head and it's eating much of the hair in the head. In this case, no, we can advance, tablets plus the cream. But if it's only involving the cream, there is no need to take tablets of any kind. We just put a small cream on the lesion that's involving the skin and the problem will be solved. There is also something called ketoconazole. That's a drug that if you take see a lot of patients taking it, that causes impotence, my friend. And it also causes your breast to be like a woman's breast. If you're a man and you're taking this medication, don't. Because you have to be aware of the consequences. You will lose your sexual power and your breast will become like a woman's breast. Okay, so you don't want that. So before you decide to put something in your mouth, investigate what I'm putting in my mouth and see if it's safe or there is another alternative that is safer than this one. Because sometimes, you don't want to pay a little bit extra, you lose something that is irreversible now. So I would like to again announce, if you know somebody and you are watching me now, please spread the news that we have a surgical team, a specialized surgical team coming to Cameroon next Friday, and they will be doing all kinds of surgeries for free, and the surgeries will be taking place in Marwa. Thank you very much for watching, and I will see you next Thursday. You stay blessed and have a nice weekend. Thank you. See you.